I'm Peter Durman, minimally invasive and endoscopic spine surgeon at Texas Back Institute. Today, I want to talk to you a little bit about the treatment of disc herniations or disc bulges in the low back. This is a condition that happens when the discs, which are the shock absorbers in the back, they can get a little defect or crack in the back that allows some of the material to pooch out. And that pushes against the nerve, which can cause symptoms radiating typically down the leg or both legs. That's colloquially known as sciatica. Now, the treatment for this is initially typically not surgery. So things like therapy, chiropractic, anti-inflammatory medications, and if those things fail, then there are even injections that can be beneficial. If all else fails and patients are still symptomatic despite those non-surgical things, we can think about doing surgery for this problem. And what the surgery for this is, on a high level, is to remove the pressure from the nerve. And what that does is alleviates that sciatica type pain, typically radiating down the leg. There's a variety of different ways to do this. The traditional way involves making an incision on the low back in the middle and going down and getting to the spine and opening up a little window in the bone, which allows the surgeon to reach in and remove that disc material that is pushing against the nerve. And then you trace the nerve up and down and make sure nothing's touching it. And that alleviates kind of that sciatica type pain. What I'm really passionate about is minimally invasive approaches, and now what's being called ultra minimally invasive surgery, namely endoscopic surgery. And so rather than having that open incision, which requires a larger exposure and opening the spine up to the world, and tends to damage some of the soft tissues a little bit more, what I do is I create about an 8 millimeter incision in the skin. And rather than open things up, I insert a camera that goes all the way down to the spine. And through that camera, similar to if you were going to get your shoulder scoped or your hip scoped or your knee scoped, rather than a big open surgery, it just makes that little incision and I can get straight down to the spine. The camera is about the width of a pencil or a pen. And that goes straight down to the disc herniation. And from there, I'm able to look at a high definition, ultra high definition monitor, and I can see what's going on in the spine without having to open things up, and work down that same channel through the camera with micro instruments to remove that disc herniation or anything else that's pressing on the nerve. This isn't a fusion surgery, and the beauty is it has very little damage to the soft tissues, and frequently I don't have to remove any bone whatsoever. Because it's so small, I can sneak in, remove that disc herniation, and kind of sneak out without doing any collateral damage. Once it's over, it takes about an hour. Patients get one stitch under the skin, and they're usually home within about an hour of surgery, walking around and getting on with their lives. Typically, people take some pain medications, often just Tylenol for a couple days after surgery, and I like them rapidly to get back to what they like to do. The most common reaction after surgery is an immediate improvement in the pain going down their legs. And that's the most rewarding thing for me. So anyway, hopefully this gives you some information about the treatment of disc herniations and sciatica. If you have any additional questions, I'd be happy to set up an appointment and we can talk further. Have a great day.